we knew going into this pandemic that critical medical equipment would be in short supply. I began getting alerts from industry colleagues in mid and late January, telling me that from an outside view, from the industry view, that the supply chain was diminishing rapidly, telling me that other countries that we relied on to supply many of these masks were blocking export and stopping transfer of those masks to the United States. I learned that China was trying to buy the equipment from the United States producers to have it shipped to China so they could make more. In each of these alerts, and there were dozens of these alerts, I pushed those forward to our leadership in ASPR, to Dr. Cadillac and his senior leadership team. I pushed those warnings to our critical infrastructure protection team. I pushed those warnings to our strategic national stockpile team, who has the responsibility of procuring those medical supplies for our stockpile. In each of those, I was met with indifference, saying they were either too busy, they didn't have a plan, they didn't know who was responsible for procuring those. In some cases, they had a sick child and would get back to it later in the week. A number of excuses, but never any action. It was weeks after my pushing that finally a survey was sent out to manufacturers or producers of those masks, a 5-page survey asking producers or companies if they actually made those masks.
In your whistleblower filing, you discuss a February 7th meeting of the department leadership group at which you urged the department to focus on securing N95 masks. Can you describe what happened at that meeting?
They informed me that they did not believe there was a critical urgency to procure masks. They conducted some surveys, talked to a few hospitals and some companies, and they didn't yet see a critical shortage. And I indicated that we know there will be a critical shortage of these supplies. We need to do something to ramp up production. They indicated if we notice there is a shortage that we will simply change the CDC guidelines to better inform people who should not be wearing those masks, so that would save those masks for our healthcare workers. My response was, I cannot believe you can sit and say that with a straight face. That was absurd.
In fact, it took 3 months from your initial warnings until mid-April for the federal government to invoke its authority under the Defense Production Act to require the production of millions of more N95 masks. And even then, the administration required the production of only 39 million masks, which is far fewer than you and other experts said that we would need. What was the consequence of this 3-month delay and inadequate response? Were lives endangered?
Lives were endangered, and I believe lives were lost. And not only that, we were forced to procure these supplies from other countries without the right quality standards. So even our doctors and nurses in the hospitals today are wearing N95 marked masks from other countries that are not providing the sufficient protection that a U.S. standard N95 mask would provide them. Some of those masks are only 30% effective. Therefore, nurses are rushing in the hospitals thinking they're protected, and they're not.
Thank you for your courageous effort.
Gentlewoman's time has expired.
I am sure there are specific conversations, emails, moments in time that you remember like they happened yesterday. The inflection points where if the response to your warnings had been heeded, things might have been different. And I'm sure they haunt you and keep you up at night. From January of this year, tell me about just one specific moment when you had that sinking feeling in the pit of your stomach because you were not seeing the response that you knew needed to happen.
Congressman, I'll never forget the emails I received from Mike Bowen and indicating that our mask supply or N95 respirator supply was completely decimated. And he said, we're in deep shit. The world is, and we need to act. And I pushed that forward to the highest levels I could in HHS and got no response. From that moment, I knew that we were going to have a crisis for our healthcare workers because we were not taking action. We were already behind the ball. That was our last window of opportunity to turn on that production to save the lives of those healthcare workers, and we didn't act.
Dr. Bright, what impact do you believe that statements by the administration leaders downplaying the COVID-19 crisis throughout February had on the ability of our public health system to mount an effective response to the COVID-19 virus?
I believe Americans need to be told the truth. And I believe that the best scientific guidance and advice was not being conveyed to the American public during that time. I believe by not telling America the truth or being fully transparent, regardless of where the information was coming from, people were not as prepared as they could have been and should have been. We did not forewarn people. We did not train people. We did not educate them on social distancing and wearing a mask as we should have in January and February. All of those forewarnings and all those educational opportunities for the American public could have had an impact on further slowing this outbreak and saving more lives.
Well, thank you.
Do you want me to talk about our... Sure. Yeah. So, you know, Dr. Bright is up there testifying today. Everything he's complaining about was achieved. Everything he talked about was done. He says he talked about the need for respirators. We procured respirators under the president's direction. He said we need a Manhattan Project for vaccines. This president initiates a vaccine Manhattan Project, diagnostic Manhattan Project, therapeutic Manhattan Project. Oh, and by the way, whose job was it to actually lead the development of vaccines? Dr. Bright. So while we're launching Operation Warp Speed, he's not showing up for work to be part of that. So this is like somebody who was in a choir and is now trying to say he was a soloist back then. What he was saying is what every single member of this administration and the president was saying. We need more personal protective equipment. We need more ventilators. We need therapeutics. We need vaccines. Every single thing this president was on, this president achieved, and Dr. Bright was part of a team and was simply saying what everybody else at the White House and at HHS was saying. Not one bit of difference. And on hydroxychloroquine, Dr. Bright literally signed the application for FDA authorization of it. Literally, he's the sponsor of it. So his allegations do not hold water. They do not hold water.
So we have had some great response in terms of doctors writing letters and people calling on the hydroxychloroquine. And this guy's fighting it. No reason to fight it. There's no reason. But more importantly than that, we've had tremendous response to the hydroxy. We've had the great response to zinc along with it and the Z-Pack. So a lot of people have sworn by it, and we'll see. But I'll tell you what, to me, I watched this guy for a little while this morning. To me, he's nothing more than a really disgruntled, unhappy person. And I'm not just talking about Alex, because Alex said it strongly, but there are a lot of people that do not like the job he did. I don't know him. I never met him. I don't want to meet him, but I watched him, and he looks like an angry, disgruntled employee who, frankly, according to some people, didn't do a very good job. All right, any other questions?